Hi, I'm Claire McAndrew, Private Insurance Program Director at Families USA, and I came down to Georgia to testify in the Senate Study Committee hearing on provider directories and network adequacy. When consumers end up seeing an out-of-network provider because they believe that providers in-network due to inaccurate information in provider directories and get hit with a big bill, this is a serious problem. Consumers also need adequate information about who is in their network when they're shopping for coverage to find the plan that best meets their needs. Fortunately, although there are problems with inadequate directories with inaccurate information all over the country, there is something that Georgia legislators can do about this. In specifics, there are 3 steps that legislators can take. Number 1 is that they can make it easier for members of the public to report inaccuracies in provider directories. They can require that health plans provide an email address, a web link, and a phone number for members of the public to report inaccuracies. And they can require health plans to respond to these reports by correcting the information in a quick amount of time, such as 2 weeks. Number 2, they can require health plans to honor the information that's in their directories. If a consumer goes to an out-of-network provider believing that provider is in-network, they can hold the consumer harmless, requiring them to only pay what they would pay to see an in-network provider. And number 3, they can require that health plans audit their directories, weeding out any inaccuracies when they find incorrect information in their directories. By taking these 3 steps, Georgia policymakers can make a big impact for consumers, helping to guarantee that when consumers spend their hard-earned money on coverage, they will find that they have reliable access to care so that they can get and stay healthy.